So I'm going to do both sides so you guys don't have to flip-flop on the table. The next tool we're going to talk about using in the neck in this position is a single PIP joint, specifically that second digit's PIP joint. Very similar to our thumb in a lot of ways. It gets into small areas. Mostly it's just spreading it out, so we're not using our thumb for all of it. The real trick to using this is not any different than our other PIP joints. Just don't have that finger hanging out in space where you're applying pressure and having to stabilize that finger. Tuck your fingers, make your fist, have your thumb supporting it, and don't put pressure on the back side of that digit. So I'm not dragging it down or using this surface. I'm only applying pressure through that metacarpal, through the phalange directly. So if I'm working in the neck, I can apply pressure to single points, come down here where levator scap attaches and apply pressure in static spots. I can drag this up and work paraspinals and get way up under the occiput with it, just like we were doing. If I want to go the other direction, I can just roll my wrist so that I'm still applying pressure into the bone rather than back and forth. I can also use this to come up over on the other side of the trap, working the trap itself, or more commonly to get in here and work on the scalenes. I don't tend to do heavy pressure on the scalenes. I like to do more of kind of a pin and stretch. So I'll find a tight spot in the scalenes, and then I'll move the head while I hold that pressure with that little PIP joint. I can avoid.
Bring that down just a little bit.
Oh my goodness. Are you okay if I move this a little lower?
Yeah.
As I do it, you know, so you couldn't say no. Not exposing anything. It's all good. Is that visible?
Yeah.
Good. So I'm just pinning a taut spot with that PIP joint and moving. So just like anything you do with your thumb, this PIP joint will work for. So I can come in and apply pressure and drag up the paraspinals like we were doing before. Come way up here under the occiput, apply some deep pressure there. If I want to go down, I need to roll my wrist so that I can push down. Is that too much?
Just a little bit.
Okay. Lighten up a little bit. Is that better?
Mm-hmm.
Good. Get in there. It goes quite a bit higher, but it doesn't bend over. I can use this for static pressure too, so I can come in and press in on that origin of the, or insertion rather, for levator scap on the scapula itself. Or I can come up and work into the trap. That's tender. Is that okay?
Yeah.
Okay. And what I had mentioned about the scalenes is coming in front of the trap and feeling around for that taut spot, holding some moderate pressure, not really heavy, and keep that pressure the same while you move the head back and forth. If you feel a pulse, move. We don't want to be working on somebody's artery. There's no therapeutic benefit for that. If you have trouble finding taut bands with that digit, you're not alone. Come in and just gently feel with your thumb, find where it's really tight, replace your thumb with that digit. And that'll let you use your thumb for what it's good at, sensing, and then use something else for applying the pressure.
Can you demo that on this side, please?
Feeling with my thumb?
Just what you demonstrated.
I already did all that on this.
We'll have it on video.
Oh, okay. So,
You couldn't see it before.
PIP joint coming up and under the paraspinals. We can do that all the way up and apply pressure under the occiput. Scream before you kick if I get too aggressive in here. If you're going the other way, you have to roll your hand and wrist over. So you're only applying pressure into this bone, not on the back side here. That can be used for static pressure. So I can come in and find the insertion for levator scap, press in there. I can also come up onto the trap and apply static pressure, or come in front of the trap and feel for a taut part of the scalenes, and then do that gentle roll, pin and stretch technique. Easy peasy. Find that finger is not a tough replacement for the thumb. Almost everything you can do with your thumb, you can do with that digit. holding that posture may take a little practice, may feel a little awkward for a while. You may really be squeezing your hand when you first start. The more you do it, the softer that hand will be. Just enough tension to hold shape is what we're looking for. So, PIP joint. Yep. In martial arts, they call that the phoenix fist. Sometimes the eye of the emperor is another term for it, if you like flashy names. Not that they help us at all.
So the person receiving won't feel a big difference between this and the other stuff we've done on this area, probably. But it's just a matter of what we prefer as a therapist.
Pretty much. This tends to be a little more pointy than the last ones that we've done. So take that into consideration and check in with your patient on how it feels. We're going to work some stuff prone with the neck, but before we do, I want to talk briefly about using your elbows in the neck. I tend to do that more prone or seated, depending on what I'm doing. But if I'm working in a supine position, we can still get in this area and use our elbow. We just have to be a little creative. If I'm working more up towards the occiput, I like to put the head in this curved or rotated position and bring that Olecranon process in from the side. And I'm just gently moving it around until I feel that little depression under the occiput. And then I can apply pressure with my elbow while I gently pull back with my hand. Is that too much?
No, that feels amazing.
When you say gently pull back, so you're pulling back?
Yeah, I'm counter pressuring. So I'm keeping her head from just getting crammed to the side with my elbow, essentially. Where this hand is, how internally or externally rotated my arm is, will greatly depend on the neck in front of me. Sometimes, honestly, it's all the way around like this to fit it in, tucked underneath. Sometimes it's kind of right in your face. It just kind of depends on the neck you're working on. If the person does not have the mobility to turn this far, their head is here, it's pretty tough to get that elbow in from this side. I would probably put them prone. Sometimes you can sneak the other elbow in, but realistically, if they can flip over, that's just easier. But if you can get their head to rotate and get access to this side, it's really easy to hold that pressure and way easier on your hands than pulling under the occiput with your fingertips. That's a good technique, it feels great, but it's hard to hold that with any real pressure for any length of time. I can do this all day. It's not like it's hard. She may like me to do it all day, but so for folks on the other side, just so she's not completely unbalanced, I'm just basically palming her head and feeling up under the occiput. And again, if you're not sure, find that depression with your thumb, get a sense of where to put your elbow, place the tip of the Olecranon, and it seats pretty well.
Okay.
So you basically using the tip of your elbow or more right here?
No, I'm touching kind of all through here, but it's right on the
you
tip.
are getting right there. Okay.
Yeah, you want it to be point pressure, not broad pressure. I'm trying to find a way to push through that Olecranon, and how bent the elbow is helps that. So you can kind of play with on the neck in front of you, how far do you need to bend your arm. And again, how it rotates may vary. So just check in. If she's uncomfortable, she should tell me. If she wants more pressure, she can tell me. If she wants less.
It's not a sharp feeling or anything.
It's surprisingly comfortable.
Yeah.
It looks like I'm trying to tear her head off, but
Looks like you're halfway there.
Mortal Kombat. No. The beauty of it is if you have a table at a good height for you, you can sit there and hold pressure, and they'll pay you to just take a nap. Just rest right here for 5 minutes, And if somebody is having a lot of neck trouble, that's a wonderful area to work, Often if I'm spending 30 minutes on the neck, if someone's just doing like a neck treatment as part of their treatment, we'll check their range of motion and have them rotate as far as they can in both directions. And then we'll have them do lateral flexion in both directions. Then after the 30 minutes, we recheck. And you'll be amazed, working levator scapula at the bottom and working up under that occiput, how much range of motion change you get just while you're working on them. But that elbow is just easy work.